Steph, thank you. Concerning. That is how our Minister of Health describes Ontario's latest COVID-19 case numbers, jumping to 203 on Tuesday. That is the highest single-day increase we've seen in the province in 3 weeks. And those numbers driven by a handful of regions, including Toronto, which remains in stage 2 of reopening. Joining me now with more is Toronto's Medical Officer of Health, Dr. Eileen Davila. Good morning to you, Doctor.
Good morning. I
want to begin with the numbers, the case count, which we saw across the province, and Toronto seeing, I guess, dozens within there. Let's break down some of the numbers in Toronto specifically, so the map that we're bringing up here. Who is contracting COVID-19? What does the demographic look like in Toronto?
Well, we are seeing COVID-19 amongst all the different age groups, certainly in our city. But over the course of the last several weeks, we are seeing a little bit more in the younger age group, but below the age of 40 is what we're talking about when I'm talking about younger age groups for certain. And part of that is that we're seeing more movement, more activity, more interaction between people, not surprising, as we continue to progress through the stages.
So as we look at the stage, obviously the concern from yourself as well as the mayor is the reopening of inside dining and just a little bit more things that you can do in stage 3. What are you looking for when it comes to the numbers for us to move on as a city to the next stage?
Well, you know, that's an excellent question. And remember, it's not just about the numbers. So for several weeks now, we've published a monitoring dashboard so that people can follow our progress and have a sense as to what indicators we look at as we seek to make decisions. So absolutely, we do look at new cases, 7-day moving averages of our new COVID-19 cases. But we're looking at hospitalizations, we're looking at outbreaks. We also look at how much healthcare capacity is, how much public health capacity there is, and of course, what's happening with testing. How quickly are we getting testing results? And when we do have tests, what proportion of those tests come back as positive? So we are seeing improvement across the board on virtually every indicator. What has been holding a little bit are the number of new cases. That's been, you know, hovering around. We get dozens, I would say, a day. You've got a map up there that shows Toronto most recent data at 30, not the highest count, as you can see there. But you know, we continue to have cases. And again, not surprising, we should expect to see some cases as we see more interaction and more movement between people. But this is why we talk about a slow, steady, and cautious reopening.
That number 203, when we saw it in the newsroom, it was alarming because we've been seeing in the 100 mark, even below that 150 mark, which you feel somewhat secure. We never should feel secure, but there was something about that line, that barrier. You hit over 2 and the alarms sound off. Do the alarms go off for you when you see over 2? Again, we're talking Ontario-wide, but when you see something like that, many people say, wait a second, are we already moving into potentially a second wave before we've even finished this first one?
Well, you know, I agree that you know, obviously I look at the province as well. My main concern has to be Toronto. That's what I'm responsible for. But of course, we look to other jurisdictions, and that includes the rest of the province, to inform our decisions. So, of course, we're watching. I think this is very important to watch. But that's also the reason why we continue to promote this notion of slow, steady, cautious, and careful reopening. And again, we can't emphasize enough to the population, whether we're talking about Toronto, the rest of the province, and beyond. We really do need to keep an eye on those W's, right? Watch your distance, wash your hands, and wear your mask. These are the things that we all need to do together. We need to work together in order to keep COVID-19 at bay.
One of the concerns that a lot of people have right now, definitely the politicians, is this bubble breaking. You know, there's that number of 10, and you're only supposed to be within one bubble. I know there are a lot of people that are in several bubbles, so it kind of just takes away, you know, this bubble, this notion of a bubble. We are running out of time, but what words of advice do you want to leave our viewers with as we look to considering moving on to the next stage?
Well, to my mind, what people need to be careful of is to continue to practice good public health measures. We are not out of the woods yet, and we need to learn how to live safely with COVID-19. That's washing your hands, watching your distance, wearing your mask, and working together to try to follow the advice we've been giving for the last several weeks. That's what will keep us all safe.
Some good words of advice. They sound so simple, but definitely they have had an impact. Dr. Davila, thank you so much for your time. Appreciate all your hard work.
Thank you.